what are some of the common sex myths, shall we say, especially in relation to women
There's
that you come
definitely
across
a
that you're
lot of
trying
myths
to debunk?
around kind of your control over your pleasure, permission to have pleasure. I think women, especially from conservative backgrounds, have heard a lot of mixed messaging around sort of the secondary nature of their sexual pleasure, that it's really about pleasing others, or that pleasure is really about a different experience or a different role in your identity, whether it's, we're creating a family, or, it hasn't really been pleasure focused. There hasn't been a lot of permission around knowing your body, having a good relationship with your body, even touching or looking at your body. So I feel like because of those mixed messages, whether it's if I do that, I'm going to be perceived in a negative way, or I won't be able to have control over that experience. I find that there's just a lot of myths around what's normal, what's right, what's okay, and am I okay because I have these thoughts or these feelings or these fantasies around sex. So that's a common issue I see. A lot of shame, a lot of embarrassment, a lot of fear around sex, and not a great relationship with pleasure as a whole. And that's really a focus in my practice. Is absolutely, we're looking at sexuality, but just your relationship to pleasure. Humans are natural pleasure seekers. So when I meet with a client from a conservative background, I want to know about their sex history or their sexual conditioning, but I also want to know, what is their relationship with pleasure? What makes them feel good? That is really what drives us and motivates us on so many levels in our life, biologically, psychologically, is our seeking to feel good. We want to have experiences to feel good. And so I find that that is a major conflict that women come in with. Sex doesn't feel good. It may hurt. It may feel shameful. I don't know how to communicate what I like or want. I don't feel comfortable in my body. So these are very common issues I see with women of all ages and stages of life. So there are just a lot of similarities, even outside of conservative communities. I think we all share similar experiences, which is why I like working with conservative populations, because they can sometimes feel very isolated and different from other cultures, but yet very similar issues, very similar concerns.
Right, right. Amazing, amazing. And again, I was just looking on your website and I
Yes.
came across your, I think it's a mind body approach to is it sexual pleasure enhancement. Can you talk a little bit about that
Yes,
and
when I was doing my
what
training,
that's
I
all
found that
about?
there was kind of something missing in psychotherapy in terms of how we were dealing with sexual concerns. I thought that we kind of hit an end of the road when you're doing the processing or talking through or working with belief systems. It was the relationship with the body that was missing. So I created kind of a model to look at how all of these factors play in together. So mind body approach means we're looking at how what we learn and what we think about sex does affect our body, our physiological response, our nervous system, and helping people understand the somatic role of sex. Because what's more body-based than sex? I mean, sex is very much about our mind, body, heart, and spirit experience. So I wanted people to understand that, sex isn't just this thing we do. It's an experience we create. It's an energy release. It's connection. And so by having this model, I think it helps people expand their own definition of sex. And to say, oh, okay, so enjoying aesthetic beauty with a partner can be pleasure, or, erotic is much more than just what we're doing mechanically with our bodies. So this approach has helped me assess differently when it comes to gathering information from clients about sexuality, and then also creating a treatment model that isn't just talk therapy and kind of processing what has gone on and looking at it more in terms of a behavioral model, but more of a whole, holistic, as in whole body, whole person model around sexuality. And it's empowering. I find that mind body approach gives you a lot more tools, a lot more awareness around how sexuality works, rather than just having constructs or schemas of, okay, this is what sex or love should look like. So I love the mind body approach. I love the movement that I think our culture is in right now around wanting more wellness and mindfulness and ways to connect on a deeper level to our bodies and minds. So it just fits in perfectly with sexuality. I can't think of a better fit than mindfulness, mind-body work, and sexuality.
How does curving the language around actual sexual dysfunction truly address people's genuine concern
Yes,
that
great
something
question. You know, I
dysfunctionally
think
wrong?
language, if anything, the power of language is that it can normalize and stigmatize, but not always in a good way. So if we're using terms like dysfunction and using a very medical model to work with sexual issues, let's say that treatment doesn't work. And now you're thinking, all right, I had this issue. This was the way that I was taught or that I learned to address it. And now it's not working for me. It really doesn't move you anywhere closer to where you want to be around feeling more sexually empowered or in control. So language is important. And it's also important to remember that sexuality is subjective. So what I try to do is not kind of bring in all of these clinical terms and phrases and overwhelm, because let's face it, they're not the most friendly words in our sexuality. I mean, for example, hypoactive sexual desire disorder. What sounds scarier than that to describe something that I imagine almost every human being has dealt with at some point in their life? So that's an example. You know, is it important to use that term to help someone understand that they have low desire? To me, not necessarily. I may kind of give information and share how we look at that clinically, but I also kind of broaden that to normalize that, yes, low sexual desire is a part of sexuality, even healthy sexuality, you know, healthy in whatever way you view that. So what I try to do is build the rapport and understand your language. How do you view sex? What do you call your genitals? How do you refer to your low desire? Do you actually say that? I have low sexual desire. I mean, some people say low libido. What does that really mean? We hear libido, desire. What's the difference? I mean, there's so much mixed language. And sometimes I'll meet someone and they'll have read so much and there's all this language and I'll say, what does that mean to you? Is that how you feel? And they'll say, no, that's what I thought this is. And so it feels even more isolating. So I'll use the client's language. I'll be curious about that. Even in my assessments, I have a lot of space where a new client can fill in their own information. I like to hear their story in their words. What do they use to refer to that? How do they refer to even their early education and history? So that's kind of my view on using the language. Now, for an individual who says this is important because that, for example, if I have vaginismus, that may be important for me to understand, there's actually a name to this. And so it helps me understand this condition I've been dealing with maybe all my sexual life. And so that gives me a sense of relief, knowing that I'm not the issue. There's something here that I'm going through that is also something that people experience. So it really varies case by case, but I think in general, I really try to open people up to expanding how they use that language so they can help, again, feel more empowered and not so broken around sexual issues, like I said, that are just so common.
Letting people know where they can contact you. You know, this is your sales pitch. Please plug in anything that you've got going, any kind of, all your
Yes,
services or where people can find
all social
please
media
let people know.
platforms at Dr. Shannon Chavez, and my website, drshannonChavez.com, and my practice is shapecenter.org. So that's where you can get information about my practice and my team of clinicians and what we do and all of our expertise. So please, I also offer a complimentary phone consult. So if people are kind of curious, is coaching for me? Should I do sex therapy? We offer a phone consult to kind of direct you to what might be a good service or to help you find one in your area. I also have many colleagues and a great network. So if we can't help you, we will definitely help you find someone who can. So yes, thank you again. I mean, I'm such a fan of yours. And this is such an honor. And anytime you want to talk about sexuality and religion, I'm here.